Health experts locally are also taking notice. 41 Action's reporter Sarah Plake heard from one doctor calling this the third wave of COVID-19.
Right now, the Midwest is being described as a COVID hotspot. Doctors around the Kansas City metro area take a look into why that might be. Doctors at the University of Kansas Health System said that more than 300 new COVID-19 cases are reported each day in the metro area. Just last month, there were 200 new cases a day.
Regionally, I think we have a lot of work to do.
They use this graph to show how the Midwest compares to other areas of the country. Dr. David Wild says we are at the start of a third wave of COVID-19 that'll lead to more cases and hospitalizations.
When people say the Midwest has become the hotspot and is the area of concern, this is one of the reasons. You can see that the trend, right, the slope of that line for the Midwest is definitely not flattening and remains on its upslope.
Cases are spiking in rural areas.
Kansas City, because of our mask order, which isn't in parts of the state, is doing better relative to other parts of the state.
Dr. Rex Archer with the KCMO Health Department says he's worried about the spike going into winter.
All of the RNA viruses, coronavirus, influenza, tend to last longer in more dry environments. So as we go into winter, the humidity is lower indoors. We're also finding that this virus doesn't just spread by particles where you're breathing, talking, but it actually hangs in the air some. So we start getting more and more people in crowded indoor spaces. The virus will end up taking off again. So it is a concern.
Dr. Archer says people need to really think twice about going to family gatherings over the holidays if they're high risk. Sarah Plake, 41 Action News.